Welcome to OT Conversations, the podcast where occupational therapists dive into the deep world of occupational therapy. We are sharing insights, experiences, and thought-provoking conversations. Join us as we explore the intricacies of occupational therapy, discussing the challenges, triumphs, and the ever-evolving landscape of this impactful profession. Whether you're an occupational therapy professional or simply curious about the field, get ready for engaging discussions that illuminate the fascinating intersection of occupation and well-being. So as you can see, guys, the conversation was focused on issues about performance, staff performance, where the performance is actually limited by one's drive and motivation and the willingness to push themselves. And we have related staff performance in the model of human occupation, where we talked about the volition aspect of it, the personal causation, the roles and habits, and also the skills of the staff. During the conversation, we also talked about some of the challenges, and we tried to establish the roots of the problems with skills of occupational therapy, and we have tapped into the surface that education and foundational education may have an issue with it as well. So I hope you will enjoy, and I hope you do enjoy this conversation between myself, Hao, and my colleague, Joan. I'm here with
Joan,
and here is just a random OT conversation involving ordinary things. Could be a rant involving occupational therapy. What are we ranting about today?
I feel like there's a lot to rant about.
I know, so it's one step at a time. Let's
For me, like, the big thing is just like the differences. Well, yeah, so I had a conversation actually with someone yesterday about this whole compassionate thing, right? And obviously it's important. Of course it is. But at some point I feel like we're almost too kind.
I know.
It's too easy. And like, don't get me wrong, I think, it's important to like love your job, and it should be fun and you should be excited to come to it, which like I am. But it shouldn't be like a little walk in the park. Like, it needs to be some sort of like a challenge.
I know. Certain professional.
And I feel like some people aren't getting challenged. They're taking the easy route, if that makes sense. And we're not necessarily doing much about it. Like, obviously we're encouraging people and we're saying, okay, try this, or how can we help you to do something, like service improvement type things. But yeah, there's just almost too much compassion and caring about how we say things and how we word it. Whereas like, yeah, back home it was, you just get the job done. It's not like a discussion. It's not like, oh, can you do this for me, and then come back and we can discuss it, and oh, how does this feel, are you interested in doing this kind of service improvement, or do you mind seeing this patient? It was like, you just do it. It was like told. You
don't ask a favor. You just do it because it's a job.
Yeah, exactly. And it's like, you're expected, the expectations are very clear. It's like you are expected to see, obviously it's a different environment, but you are expected to see every day 8-9 people.
I know.
Whereas, yeah, it's like, it's a negotiation whether you even seeing 3.
Okay. So we're talking about from a supervisor down to a junior member of staff. Okay.
Yeah.
How do we set those expectations?
You see, I think a big thing in this country is, so we've got the different positions, right? Which is important. You need structure.
Yeah.
But at the end of the day, you're qualified, whichever banding level you are. You're both qualified.
Exactly.
So it shouldn't be like, oh, but she's only at band X.
Or a band lower than you.
Yeah, it's just like
you're a professional and you should be
Yeah.
able to do those things.
Exactly.
You're right, and I think this is a problem as well. There is this agenda for change. Before it was banding of band 5, band 6, band 7, band 8. Before this, there was like basic grade OT, senior 2 and senior 1. Those were the grading. And then they made it to a point where it came to a point where people have always said, oh, I'm only a band 5, so I'm not doing anything. Or I'm a senior 1 and I'm a senior 2. You know, people are always putting their banding. So what they've done is they put this agenda for change for banding just for the purpose of salary, really. With the point that all therapists should just be labeling themselves as occupational therapists.
Yeah.
Without any banding, because you're right, a band 5, a band 6, it doesn't matter. You have to be able to see patients, and these are all basic assessment, goal and discharge planning, problem identification and intervention. You need to direct that. I'm stuck as well because, like yourself, we're in the position of leadership. Our question is, how do we encourage this? How do we improve this? How do we improve staff's performance and efficiency?
Yeah, because I think we're just so focused on, like, it's just the banding. I mean, I don't know how many conversations I have people, and it's like, oh, but what band are you? I'm like, well, that's irrelevant, isn't it?
Is that what they ask you?
Yeah, it's just like, well, what's your banding? Or like you speak about someone, it's like, oh yeah, that band 3 or band 5 or band, for me it doesn't make sense.
It's an insult even. So what?
Yeah.
I'm a band god.
Exactly. Like, I've been having conversations and it's just like talking about this one person that we both mutually knew, and they came out of nowhere and was like, well, you do know he's only a band 4. And I was like, well, like, what is the relevance to the conversation? Is my opinion not supposed to change on this person? Am I supposed to feel like more...
Is it clinical though? What's the question in relevance? Has clinical relevance?
No.
So really nothing. If it's character, personality,
Yeah,
then banding doesn't really matter. Isn't it? Oh my god.
It's like you meet someone for the first time and it's just like, well, what level are you at?
Wow.
I get, like, for more complex cases, I get the importance of the banding and having, like, the title, I guess you can call it. Because then, maybe patients' families feel like, okay, now at least it's someone a bit more senior, or they're not just like...
A doctor is a doctor.
Yeah.
Regardless of whether you're registered.
But then you see, staff as well within the hospital, I feel like are very fixated on that. I've noticed that certain staff members are more willing to come to certain individuals within a team than others. And just like based off of like, having conversations with other colleagues. And it's like, yeah, well, this staff member is quite rude to me, or doesn't talk to me in the same way that like maybe they talk to you or someone else.
Because of the banding.
Yeah.
Isn't it?
Literally.
It's the human nature of things. Now we're going on the personal and character things, because I thought initially this conversation, I think we started out
Yeah, we did.
We started out with the conversation is, you're an occupational therapist, you need to be able to perform your duty regardless of your banding, and shouldn't use the banding an excuse for inefficiencies and ineffectiveness. And yes, that's quite true. And again, from us in the position of staff who's had more experience, and that's the most difficult and challenging thing to do, isn't it? To motivate a staff. There are only two ways around this, isn't it? You give them a carrot or you give them a stick, isn't it? And which one would you prefer to use? Isn't
But
it?
what if it's neither?
What do you coax on the personal drive and motivation?
And what if that person doesn't have any drive or motivation?
Okay.
Essentially, it's kind of like I'm here just
Just to
to
work.
get paid, really. I don't have any interest.
Okay.
Then what? How,
So if, for example, so we're talking about this is interesting. If we're occupational therapists and not just personal care, so we can tap on work. This is work, isn't it? Mm-hmm. So it is. So occupational therapists should really be good at motivating and coaxing people, isn't it? Because this is work. What is this? Work participation, work performance. So not exploration, because they're already here. So they know the job. So how do you enhance their work performance? And if we use an OT, again, you talked about interest. So if we're talking about models, right? So MOHO would be there. You tap on their interest and their values and their personal causation. We talk about the person's values, which may need some work, the person's interest, which will need some work, and their personal drive. What's their personal drive, which will need some work? Okay, so set that aside. The next would be the habits, the roles and habits, isn't it? Habituation would be roles and habits, which means go through a routine. So that's something we can probably manage, okay? The routine and the habit. So these are the expectations, you need to do this. So if we, without the knowledge of the staff, I think we can probably shape the patterns.
Yeah.
So
I think as well, being in the team, it's so small. Whereas if you look at like other teams, across the hospital, for instance, a lot of like the line managers, they don't know the staff.
Exactly.
So...
But they have an expectation.
But yeah, essentially, at the end of the day, the job just needs to get done. Like, you need to be able to do the job and work to develop the actual profession.
That's going to be our mission then. It really is, and it's just slow. Then, so after the roles and the habits, the next one down would be performance, isn't it? And the skills. Is that something that's missing? So is that something that we probably can help out? I know we can't spoon feed everybody, and this is the challenge. We're having to spoon feed people, but its skills and performance is an issue. So it means we need to have education program. We need to do more. It's a very difficult thing because it should have been the university's responsibility, isn't it?
I think we're just missing a lot of the foundations.
Okay.
It's a lot of the foundations that aren't there. And obviously, how can you build up something when you don't even have the concrete baseline foundations to be able to do your job? It shouldn't be our role to now go back and teach all these things. But essentially, if you, even standing on the outside, like you can see that there's just so much lack of knowledge.
But we can't send them back to university now. So it really lands on our plate, doesn't it?
But then it's as well, you can do so much training as,
on your own to coax on.
But that won't happen because there's no interest of doing that in your personal free time.
Yeah.
So for instance, if I don't know something, I go home, I Google, I search, I watch YouTube videos to be like get a better understanding. Like that's how when I started my job here, I mean for me it was very unfamiliar with like the different procedures and so forth. So I did a lot of self-study. But you have conversations with other people, they don't do that. When they step outside of the hospital, that's them done as an OT. It's not their life. So I'm not saying it has to be your life, but the thing is, you are, what you know is what you're going to bring to patients.
And that's what I call, that's the proper definition of professionalism, isn't it? You have to do the role, you have to be professional, and with that professional job and responsibility involves being responsible to your ability to deliver the job.
So I guess in a sense it's like, do we kind of question, have something, and then we've spoken about it before, like doing something where we can see exactly where the gaps are, like kind of like a little test.
Exactly.
See where
I've
the
done
gap-
that before, you know.
Yeah,
I've worked in a stroke unit, and everybody that goes in gets an exam, a test, so that I would identify where the problems are, and then once it's there, then at least I can tailor it. They don't like it.
No.
This place and the country is more essay in terms of their exams. A lot is essay. A lot is about spoken words and written words and how eloquent arguments are being, where the amount of words that you use and all these adjectives and adverbs and all of these things. But really, you don't need to know all the basic foundation is right. Yeah. So I think that's something that we can work on, isn't it?
So then you kind of do like a little test, see where they're at, and then we can work from there. But then the problem comes in, what if there's a lot more than what we originally thought? Which essentially is what we're thinking now, right? We're not thinking that like the basics are there, like the fundamentals are there.
That's why I thought about doing things in a recorded session, for example, or we use not social media, but all of these technology, because these things happen. It comes back all the time. It just comes back all the time, and I'm tired. I get tired talking to people about this and this, and they don't really do it. There's no drive. You're right. There's nothing that motivates people once they started getting paid. There's no motivation anymore, and they don't get any grades. And the only way around it, unfortunately, sometimes will have to be the stick. People need to be fearful of something sometimes, and you don't want that, isn't it?
Yeah, but that's how it is. I'm saying that's why people are too kind. It's too much. We're too focused on the compassion than the actual excellence of.
Very good. Yeah. I think that's a very good one. You're right. We need to focus on our excellence.
You can't be just compassionate and be able, it's not enough.
Okay.
So, but then also the thing comes in, well, we've done in the past little quick study sessions, right? Going through certain things and then practicing. But no one practices. Or continues then to build up on that. So you do it, but it's almost like, is it wasting your time?
It is tiring, isn't it?
It's tiring for the person doing it, but also it's not going anywhere. Because you can ask someone now, what did we go through? Can you remember how to...
They don't.
They won't know how to do it.
I know. And I know some of the habits of people do is they want some training. They want to be sent into a training program. They wanted to pay just to get that certificate, and yet in the end, you're right. It's like, I've got the certificate, and I don't need to actually learn it.
And then, new staff comes along, and then it's the same process again.
Yeah, no.
Because essentially, those new staff should be taught by the staff overseeing them. But the staff overseeing them is not necessarily the staff that has the basics, the knowledge.
I know, and that's why.
So we've got a lot of gaps.
And it then deteriorates. The knowledge deteriorates, the skill deteriorates, the quality deteriorates.
And I agree with you. And the thing is, it's being seen from the outside. It's not, obviously within the team we can see it, but as well, if you look wider, like the MDT and what they see.
Can they see it?
It's being noticed.
They can sense it, yeah?
Yeah, of course.
And MDT can sense it. So that's a good insight, Joan. We know that there is a problem. We acknowledge that there is a problem. Now there's nobody else who's going to act on this apart from us with our staff whom we're working with here. But this is also, if there are any universities, UK universities out there who's listening, they need to step up the game, isn't it? And I'm telling you, different universities have different ways on how they grade their students. So it's and that's another topic for another conversation, because at the end of the day, it's how their system, how you would adapt to their system. They feel that they're doing well because they have a robust and beautiful web pages and websites and things like that. But at the end of the day, I always say it, within our staff and within our team, I always say, at the end of the day, you teach a person how to assess, how to identify and plan the treatment, and how to implement it. Just those basic things. Well, this is this is OT conversation, but it's more like rant involving occupational therapy, isn't it?
Yeah. I guess one more point that I could add is, so essentially when you have staff that aren't present, and it's more, how do I say it? It's not really felt in the sense of you actually feel a bit more productive, or like things are just getting done. It's easier.
I agree.
So I don't know, maybe that could be something that's discussed in another.
Yeah.
But essentially, yeah, if you have, staff are off, essentially you should be able to feel their presence gone, and it should increase your workload and pressure and so forth. But when it's having the reverse effect of whether it's maybe more refreshing, can I say?
I know.
It's just easier because then you don't have to worry about the whole teaching and motivating, which is tiring, it's draining. Because you just have to focus on you and getting the job done.
I know. All you need to do is look at the problems and let me sort it out themselves. Yeah. Rather than you can see the problems, but you have a responsibility to pass this on, make people see that there is a problem, make people act on the problem that you could have just addressed and solved yourself.
And there's almost like a coaching of like, okay, can you see it? What do you think? What is the plan? Do you have a plan? And often the case is no. You need it's like holding people's hand. Sometimes it's just easier to let go and just do it yourself.
And I feel you. I know that. Sometimes when there are staff and you know that they're reliable members of the staff and they're around, it's like you could almost breathe saying, oh, thank goodness they're here, because you know that they can help. But when there are other staff who's not there, it's like, oh my goodness, this is it. What was this? I came across this information. They were saying that 80% of the problem that you encounter with work is caused by 20% of the people you're working with.
That's very true,
isn't it? It's the 20% of the people that are causing 80% of the problem.
Yeah.
Wow. Wow.
Because to be honest, the job's not stressful.
It shouldn't be.
Especially in the hospital, it's a good hospital. Everything's everything's there. There's so much opportunity for development and new initiatives. But what's holding it all back is the unnecessary stress of dealing with the staff. If I didn't have to worry about staff, essentially,
it would have been straightforward and easy. If it's just pure clinical, and that would be a band 5, band 6, these are pure clinical posts. All you really need to do is boom, see patient, assess, discharge, address, plan, and you need to hone your skills by seeing more and more and more people, isn't it? Rather than by avoiding patients and responsibilities. Now the challenge obviously is again in the position of leadership, like a band 7, for example. Oh my goodness, this is it. Part of the responsibility is the headache, or part of the challenge is the headache. Is it worth that extra hundreds of pounds? Sometimes you think about it. But I have been, or had been, a clinical band 7, with the expertise and the knowledge and the specialization, because you've seen a lot of things, and it's easy as well, because all you do is see patients, easy, straightforward. But then you're right, it's the motivation. Oh my goodness, that's more of a challenge. But what have we identified? Motivation, interest, their personal drive, which you don't have a control about. If that's a higher level, can we build up on their habits and roles? Perhaps. But the very basic one, which is performance and skills. And unfortunately, we have to find ways on how we could enhance that, isn't it? And in enhancing that, what you were saying is maybe we should be better at having a pre-assessment of their skills, just like initial evaluation, isn't it? Where are you? And then it has to be a very robust program where people would stick into, where it is almost mandatory,
Yeah.
rather than a voluntary thing.
Yeah, no, it definitely has to be mandatory. But also, it's the way in which it's done, I think. Because, I mean, we have a lot of mandatory trainings. And how many times is it just, if it's online, for instance, it's a click, 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 click. I don't read anything. I don't learn anything. I'm doing it to complete it. So then it's like, how do you do it in a way that people are actually going to learn and get something out from it? Then do you do a post, like an assessment afterwards and see, compare?
After every rotation, I guess. This is it. This is what I've learned. What about measuring performance based on the numbers of people you're seeing? Isn't it?
Yeah.
Isn't it?
I think that expectations have to be very clear.
Yeah.
Because, yes, the different banding levels have the different expectations, or, it has the different criteria. But that could be interpreted very differently to each individual.
Yeah.
So if they're aware, at this band level, you have to be able to do this.
I know.
You can't be seeing 2 people or 3 people.
I was looking at this recently because I'm worried about it as well, about the number of input. And then I looked at, like, say, for example, I was in one ward where the specialization is more say respiratory, and you don't do restorative occupational therapy, and what you do is more supportive discharge planning, supporting the environment, lots of modification, lots of communication and liaison outside. And what I've realized is it does take time. For one case, about an hour, 2 hours of it, where it's complicated, like ordering equipment, complex meetings, wife ditching their husbands, they don't want them home, so it's really complicated. And I thought, yes, I acknowledge that sometimes it can be lengthy, particularly when you tap onto the social aspects on which OTs are very much involved with as well. But then, yes, there is that. But then if you look at our numbers, 50% of the time is still missing. You're right. So I don't have any excuse to say, look, I know it's complicated. Maybe it justifies 2 or 3 patients a day. But if you look at how we're recording our activities, still there's a big gap in what's missing. And I don't know if there's a lot of people looking into this at the moment. It's just at the moment being brushed aside or underneath the carpet. But yeah, there is that, and it's not just the profession of occupational therapy. Our colleagues, physiotherapists, have the same issues. 50% is missing.
But then I question: is it people understating for that?
Yeah.
Because I don't stat properly, and I know that. But then, in the sense of where people are now aware of looking, is it going to come to a point where people are now over-statting, essentially? So we get now the idea or the perception that they are doing a lot more than what they're actually doing. Because, you can just sit and watch people, and you can tell how much they're doing.
True.
So, is it going to come to a point of,
I think we can... So another line of action potentially can be, we can potentially... our input, we can have a time frame on that. Like functional mobility retraining, it's about maybe 15 minutes. Washing, that's probably up to 30 minutes, isn't it? So you can count your sessions. It's like, oh, you've done like washing, dressing, functional mobility, that will sum up to 45 minutes. And I find that, again, it's like opening another can of worms. Documentation is adding a lot, but that's an expectation. We're going to grapple with this at some point, but it's good that we are highlighting this. Yeah. Okay. Wow. What's the word? Is that sombering? Is that the term for it? You have a feeling where it's like you don't know if you're sad or there's some kind of a...
You're like in limbo.
Melancholic, emotion to this conversation now, isn't it? You want to do something, and yet, when you're faced with reality of what's happening in there, you can do a lot, but you almost feel sad for for the others and for the profession.
Yeah, I think it's going to do more than profession. It's like seeing the opportunities and everything that's available, but just us not doing anything, or like really using our full potential, and that's sad.
I think from my perspective, I know we're doing something. I think the difference here is the rate of your expectation. Are we doing it fast enough? I am aware of this. We're slowly working on changing this because it's really very slow, and I think that's where, what I'm sensing is I was like that too. It's like, why is this not happening? Why can this not change now? And along the way, when the approach is too fast, it tends to have more, what's the word?
Resistance, maybe.
Exactly, resistance. And
it's more of a negative effect.
It's like when you're diving in the water, when you dive and it's done the nice way, good, not a lot of splash. But if you go and dive where it's like a, what's the word, vomit, and there's more splash, more waves, and it's more resistance. So I call upon patience, and it's good, don't lose that that drive, because I think you're one of those few who's an OT because you're an OT, and it's not just a job, it's a character, it's a vocation, it's something that what you do. And I do enjoy this conversation. Yeah, did you enjoy this conversation too?
Yeah, it was really good. Thank you.
Should we have more of this?
Definitely.
Okay, we'll have more of this.
There's a lot to talk about, isn't there?
Really good. Okay, once again, guys, my name is Hao.
And I'm Joan.
And thank you for listening. Until next time.
Bye.
Bye.